Hi everyone, this is Dr. V from Delhi, India. I will specifically talk about the conditions that could, result that could, manifest themselves in a patient of COVID, post-COVID syndromes that we are talking about and we are discussing so much. There is like a lot of discussion on this topic right now. I'm just going to pinpoint the main things that are the effect of COVID and the effect that is presenting chronically in our patients as well, in patients who have actually healed from COVID. So the first and foremost, that's the most common that we are looking at these days, is the weakness, right? The weakness that's not leaving COVID patients. I would point out some main remedies that come to my mind when I talk about weakness post-COVID. It's Chininum Rs, it's phosphoric acid, which I personally used with great results, sarcolactic acid as well. But again, it's one of the rare remedies that we use. It's not one of the most common remedies. And no-sodes, which I would not suggest you self-prescribe, and they should be used only under the care of a professional homeopath. So the next thing that is, another effect that's very common after COVID is loss of smell and taste. So again, the entire muriaticum group, it could be Magmur, it could be Natrum Mur, and several other muriaticum group can be a very good class of remedies that we are looking at for this particular symptom. And a few doses of the constitutional remedy, they are really helpful to deal with loss of smell and loss of taste, in patients post-COVID. The third thing that I would like to talk about here is cough and coryza, which also is, lingering in a lot of COVID patients. I would want to mention some remedies also here. Kali Sulph comes to my mind. Kali Sulph can be used in such a condition. And antimony Rs is a great remedy as well for cough and coryza that is not, going in a case that is in a patient who has suffered from COVID. Even post-COVID, there are people who have recovered, but they still have some low oxygen saturation remaining with them for a few days. So Aspidosperma has been already mentioned a lot in this connection. And it is a very, very good remedy if the oxygen saturation is not bouncing back to absolutely normal range and it is still slightly low. Even post-COVID, this remedy can be used in not just in tincture form, but in any low potency, 3C, 6C, 12C as well. These low potencies can be, better for raising the oxygen saturation in the body post-COVID as well. Then the last condition I would like to mention here is lung fibrosis. So lung fibrosis is basically some damage to the lungs that is still, that the patient is not recovering from. There is fibrous tissue which is remaining in the lung after COVID. Some remedies to mention, especially here, are theocinnamonum. Then beryllium is also one of the remedies that comes to mind. Kali iode comes to mind for this condition as well. And there's a rare remedy called bleomycin. That's also a remedy that's indicated in lung fibrosis. No-sodes again help with this, but never self-prescribe no-sodes, and always, work with a professional homeopath for such prescriptions is what I would like to mention here as well. So I hope all of you are recovering and safely recovering from COVID, and these symptoms, leave you as quickly as possible, and the recovery is fast and quick. And in case, you're still struggling, please get in touch with a homeopath, and we can really help you with these things. These post-COVID syndromes are very, very good cases for a homeopath to deal with. All the very best, and bye from me for now. All right.